When I graduated from Birmingham Southern, I wanted to go to medical school. I knew that many folks were going to get a degree in public health and then reapplying for medical school, so that's what I decided to do. And fortunately, UAB Hospital is across the street from one of the best, schools of public health in the country, so that was convenient. When you get here, if you give yourself an opportunity to realize what other opportunities there are in healthcare outside of the strict acute care setting, I think that you're going to realize that, schools like SOPH here at UAB, really give you the opportunity to realize a wider set of interests that you didn't even realize you had. One of the things that led me to really, once I decided I didn't want to go into acute care medicine, that made me want to stick with this field was that, I realized that I could work with, one patient at a time, 30 patients a day, or I could go into something that would allow me to, look at health from a much bigger volume, much larger volume of lives affected by my career. And when I got to MedMind, I realized that this tool would enable me to interact with hospitals around the country and around the world on the volume of millions of patients all day, every day.
With the help of the scholarship, as a graduate student, being full-time between class and also outside of class, working on projects or papers, or reviewing articles or whatever other assignments. There's not very much time, particularly if you want to achieve scholastically. Through the scholarship, my free time I was able to run for office and be a representative in my first year, continue on to be interim president, and during that time to be able to work with the student association, get to know the students, get to know the professors, get to know people who are involved in public health and different community partners. Not only did a service to myself, but was allowed me to enhance my education, particularly outside the classroom. If there was something that I could say, particularly to the people that have contributed, I would want to tell them that without their help, I would not be particularly sitting here today. I would not be involved in public health. I may or may not have been able to attend school, and not only are what they're doing is extremely generous, but they're helping to advance the field that they care about. The field of public health is a field that it's made of a lot of great science and stuff too, but it's filled with a lot of emotion because we care about people and we care about each other. Hopefully, when I'm in their situation, and have been a professional for years in the field, I unquestionably will continue to help in any way that I can, not only people involved in public health but also students, because for one, being the trite expression, walk a mile in that person's shoes, I certainly have done it, and I will do whatever I can to help others.